non-invasive ventilation is a very simple technique where there is a machine that sits beside the bed which has a turbine inside and often looks like a little radial alarm clock. And there is a mask over the patient's mouth and nose, sometimes just over the nose, but nearly always these days we try to opt for the full face mask. The machine supports the patient's own breathing. When you breathe in, the machine recognizes that and supports the breathing by blowing air in at a certain pressure preset in the machine. When you breathe out, the machine senses that and the air comes off. This therefore improves oxygen levels in the blood and removes carbon dioxide levels from the blood. And we now know that if we use non-invasive ventilation in that group of patients, and those patients use the device at home for at least 4 hours every night, then that will reduce their likelihood of going back into hospital with another worsening of their COPD, and is also likely to improve their length of life. Whilst at the same time, it will improve the symptoms for patients if they have any symptoms of sleep disordered breathing. So those are symptoms like poor quality sleep, feeling rather sleepy and tired in the daytime, waking up feeling groggy with maybe a headache in the morning. It is very important to realise that when you use non-invasive ventilation at home, it is a completely different experience to when you use it in hospital. When you come into hospital, you're frightened, you're anxious, you're feeling very unwell. However, when you're at home using non-invasive ventilation, the masks are often much more comfortable. The machine is nearly always much smaller and much more compact. You're in your own bed, you're in your own home, and therefore it can be a lot less anxiety provoking and more comfortable to use. There are some patients, however, who do feel very claustrophobic with using non-invasive ventilation. However, there are a lot of different masks available to us to use at home, which can reduce some of those feelings. And with ongoing support and just slowly getting used to the device, often, but not always, you can overcome those problems with claustrophobia. So patients can often and will often say to me, wow, this machine has changed my life. It has made me feel so much more awake, so much more alert, and in some cases, less breathless. I have been so surprised in my 17 years working with home mechanical ventilation, so non-invasive ventilation at home, in terms of the life-changing events that can occur because patients who've had symptoms of sleep disordered breathing for many, many years, and we've turned their lives around because of non-invasive ventilation at home. Patients will often come into clinic and tell me they are now able to go out more. For some people who they're not able to go out and about as much as they would like, being able to sit down, read a book, watch television without falling asleep are really, really life-changing events.